Morning at NTV, we're live from Kampala Swena Conference Center. Mandru Chamagiromuntuawansi, and this conversation is live on Twitter and on Facebook. Those watching us from Abu Dhabi and Kuwait and Dubai, we want to say thank you so much for being a part of this. Bakadama, thank you so much for being a part of this conversation. Now, unresolved questions on COVID-19 vaccination. I saw many of you online making a lot of assumptions, accusations, and counter-accusations about the COVID-19 immunization vaccine that is already here. The president yesterday said he's about to sue the Daily Monitor for making defamatory statements about him, vaccinating his team before the vaccination got here. That's another issue. For the first time, the president is talking about something he says is already in court, and he's talking about it publicly. Now, today, to bring this conversation to context, we have Elizabeth Atori from ISA. You understand ISA with the vibrant women in there. Then we have Anne Lumbasi, the program officer of SAHAD. They're here to bring this conversation. Good morning, ladies.
Good morning.
Good morning.
Happy Women's Day.
Thank you, Andrew.
It's your week, and we're focusing on how best we can amplify your conversations. Just to start with you, Elizabeth, you're from ICE, and this is right to know that a day before Ugandans receive their faster COVID-19 vaccination, what are some of those unresolved questions we as Ugandans must ask ourselves?
Thank you very much, Andrew. And I want to say thank you for having me. One of the things that ISA has continuously pointed out is the fact that will these vaccines be accessible to all Ugandans? Will Ugandans be able to decide whether to have a vaccine or not and just freely walk into the vaccine centers and get the shot? And that's one of the key things that has been important to us, particularly because on 2nd March, the Minister of Health released a statement. And in her statement, she stated that in order to get a vaccine, you would need to provide a national identification
Of course.
or a national identification number just to be able to get the vaccine. And knowing the challenges that Uganda has faced and that Ugandans have faced in order to just be able to walk into NERA offices and come out with those cards has been an issue for us. And this hasn't been an issue that has started. You see, when they were started with the digital identification system in Uganda, one of the key things that they decided was that this system would help Ugandans be able to get services easily and to be able to access public services.
Timely services.
So it should be, I walk into the hospital, I present my national ID, I get a shot, and then I walk out. But given the prevailing circumstances, noting that a significant population of Ugandans do not have these national IDs, and even those that would want to get the national IDs, particularly those of mixed race, non-indigenous Ugandans, who have been turned down, older persons that are one of the key target populations for this vaccine. So many of them do not have these national IDs. So the question is for the government, I think, what are we going to do with these Ugandans that do not have national IDs? Isn't their right to health and their right to life a priority to us? And should we then tag the giving of a COVID-19 vaccine to the
National ID.
So that's a key question for us. The next thing that we would want to see is a roadmap of sorts, and then what happens to the rest of the Ugandans that do not know, because you see, what we have is a statement released, and then what?
And it says 9 million only will be in position to get the jobs.
Yes. So what happens to the rest of Ugandans? What we want to see is a comprehensive plan, a roadmap that includes all Ugandans, and not just particular Ugandans, and does not exclude any single Ugandan. So even if the vaccine is voluntary, as a person, I should be able to walk into a center, a vaccine center, and get a jab if I decide to.
From where you look at this, and do you feel as time goes by, the vaccination will be paid for?
I think, and that is exactly what we are saying. We've seen this with the treatment of COVID. There have been private facilities that have been allowed to treat patients for COVID. The costs are exponential. The out-of-pocket costs for a normal, ordinary Ugandan is just too high. So what do we as Ugandans and we want the government to be able to lay this down for us. Are these vaccines going to be free all throughout? Are they going to allow private providers to be able to give the jab to anyone? And what are the regulations that have been set in place? But particularly, again, Andrew, what I would want to emphasize is the issue of tagging public services to getting a national ID is not something new. We have seen it before with our work at ISA.
Oh, yes.
When we were working under the Social Assistance Grants for Empowerment for the Elderly, we saw that they had to, an elderly person in Chotara had to provide a national ID just to be able to get SAGE.
Yes.
And without that national ID,
you're not an elder.
You're not an elder in this country. You're not able to get SAGE. You're not able to get the grants that are helping the rest of your friends. So a lady in Chotara walks into the sub-county offices, and she has gone through the processes. Yes, she has been able to write down the application. She has her form, and they tell us, come with your form. So she comes with her form, and when she reaches there, they tell her, well,
it's
there
a
is no
national
computer, right? She wants to process her national ID. She wants to acquire her national ID, but they tell her the computer is gone. So what does this elderly lady do? She's left with nothing but to go back home and wait for perhaps the computer to come in. There are different cases. You see, once you're getting the national ID, they require that you put in a fingerprint. So the biometric scan cannot read the elderly's fingerprints, mostly those from the rural settings, because their hands are callous and rough, and they cannot be read into the system. So these are
clear images we need from the government.
Images that we need the government not only to state that, look here, this is our plan for the COVID-19 vaccine, and we commend them for that. We thank them that they are prioritizing the rights to health of Ugandans, but are they actually including all Ugandans?
Lombasi, this brings me to you. Some of your colleagues, when you look at the different aspects, have been obsessed with access to national ID, like she sounds here. Very much more vibrant on that. How should people be identified as Ugandan nationals, from your perspective?
Well, I think, like she mentions, there are issues. Of course, the national ID should be the ideal, but there've been issues, processing them, having them. When they get lost, acquiring another one is a battlefield. It's very difficult to get another one. So there have to be alternative measures. And she mentioned about the vaccine being voluntary.
Yes.
We were in a meeting last week with an official from Ministry of Health, and they actually said it's going to be mandatory. So it's
so how does it become mandatory when it is tagged on the national ID and others don't have it?
Of course, those are challenges that we need to look at as citizens, as civil society, and also to bring them before government to address those issues. The issues, even in terms of awareness, there are misconceptions about the vaccine. People saying it will cause this, it will cause that.
I've seen it online. Someone was tagging me in that tweet and saying that someone died somewhere in Kuala Lumpur taking the same vaccine and said Uganda, and I said this is propaganda. I won't take it for that.
Yes.
But I want, from your perspective as an activist, or an advocate of this kind of conversation, how best can we identify Ugandans?
Before the national IDs came into place, there were other alternatives that people used to use, either to get a passport, the LC letter. When you were opening a bank account, you'd have an LC letter, or your voter's slip, or the
driving permit.
Actually, even LCs would give you village cards. So those are alternatives that we can use to ensure that there's equitable access, because what she's talking about and what the ID brings, the issues that it brings about, is the issue of equitable access. Everyone who is supposed to get the vaccine should be able to get the vaccine and not barred by anything like the national ID. So there have to be alternatives. There have to be those measures that have been used before in the past beyond the national ID.
And the way you're talking is, are you doubting the government transparency about the vaccination program? Do you have some doubts of the transparency, how it's going to be done?
Well, we haven't received a comprehensive report as yet, so we are operating. Yes, we are operating on assumptions, and we've seen issues.
Assumptions? The clusters we had. No, the minister was clear. These are the clusters we're going to receive. We have 9 million dosages for people, and we are going to dispatch as and when we start.
Yes, but even in terms of who the priority or the people they've chosen, the priorities who are getting the vaccine, even that we don't know how sorry, how it's some categories, whether they are actually vulnerable, how they came to choose them to be on the list. For instance, the security personnel, in my opinion, they are not vulnerable, so why are they on the priority list for the receiving of the vaccines? So those categories, yes, for the elderly we may understand they have, and then people who are exposed, who have comorbidities, they have other underlying factors, those are understandable. But there are some categories where we need to think again, was it being transparent, how did they get to this? And also we've seen, of course, previously scandals around vaccines and all those things. So, of course, our trust will not be 100%.
Bring back the Mabag scenario here. All right, Elizabeth, what do you make of that? How do we fix this? From Anne's perspective, she's on the edge. She's not so sure what is happening on the other side. A lot more is in void. The minister is saying this, government is doing that, and people are watching. How best can we handle this?
I think one of the key things that we need to think about as a country is how do we ensure access to information for all populations? Because you see, the challenge here, Andrew, is so many people do not have the right information. And if we can only sensitize the population and let them know and give them some kind of plan, put them in the right direction, we would not have all these misconceptions about, is the vaccine relevant? Is it able to deal with other issues and all that? And so even because as a country, if we work towards access to information, then we are able to bring in people and ensure that people participate in these policies. So then we would have a population that is able to participate in the policies and the implementation, and then you wouldn't have questions around, or why are some Ugandans being left out? So that's one of the key things that we can do as a country, ensure that there is access to the information.
Rightful information. Government, just to cut you short, Elise, government was very clear when we got into the COVID-19. They said their priorities are health, paying pensioners, and security. Others can wait. That was the PS from Ministry of Finance. But again, looking at this, what you're saying with information, do you believe the Minister of Health has not done enough to sensitize the population?
Well, I wouldn't say they haven't done enough, but if you want to evaluate whether the population is aware of what they should do and whether the policies that are being rolled out are working for them, then just determine from the feedback that you're getting from the population. And you yourself say that you have been seeing so many questions on social media. Clearly the population has some key issues that they need answered. One of them is, what happens to Ugandans that do not have national IDs? Where do you leave them? And what solutions have you put in place for this thing? And my colleague here said one of the key things is that we could use other official documentation that has been accepted. We have the permits, we have the
birth certificates,
we have the birth certificates. Birth certificates, meanwhile, are being issued by Mira too. So what we have are systems that can work, and only if we have the will and the zeal to be able to include all Ugandans. And as ISA, we thought this particularly important, that all Ugandans, given that we are working in the times of a pandemic, and our normal has been disrupted, we thought it important that all Ugandans be able to access this, and we've raised these issues with court. We've filed a case in court, and we hope that at least our judiciary, this time around, given everything else, will be able to speak to some of these issues.
What do you mean by this time around, Elizabeth? I want to go one forward here.
I see where you're taking me, and I refuse to comment on that because I will not talk to the merits of the case.
Okay.
But it still shows that this particular issue should be met by the government. The government should be able to help us understand in simple language with information that is valid. What plans do they have for Ugandans? And do these plans include all Ugandans, whether mixed race, whether the elderly, all these target populations that they want to vaccinate? Meanwhile, the older persons that they want to vaccinate do not have national IDs.
So how do we bridge the
They know
gap?
this, and they know this because they've been implementing the SAGE program.
Yes.
They know how many older persons are not able to receive SAGE because they don't have national IDs. And the Minister of Internal Affairs was also asked and tasked by the Parliament to be able to explain what the inefficiencies with NERA are. So the government is aware.
So do
What
you...
they're not giving us is a solution.
Elizabeth, are you alluding to the fact that there is a failed system? Because from internal affairs to Minister of Health to the bigger picture, the roadmap of the vaccination and all, do you feel, as a Ugandan, without cohesion, do you feel that there is lack of clear systems approach to this?
There is a system that has gaps.
Okay.
And there are gaps that need to be filled. And as our leaders, as the government, they should be the one providing the solutions. And yes, they should ask for the population to participate, and the population should be able to air out their views. But however, the ball still goes back to their court. They should and have the duty to ensure the right to health and life of all Ugandans, irrespective of whether you have a national ID or not.
Or not.
So why take the COVID vaccine
To
the
national.
national ID?
Lumbasi, despite the lack of information, like Elizabeth here says that there is no quantifiable information about the vaccine in the populace, the government has been clear from the start that everyone will get the vaccine free, irregardless how much it costs. Do you believe this? Because earlier on you alluded that we've had previous precedents where vaccination of the vaccination ran into the laptops and that kind of hashtag of accountability came through.
First of all, I think maybe I need to comment for what Ministry of Health and government is doing at the moment. But I believe we may not have the capacity to have everyone vaccinated. And of course, in terms of...
Why do you say we may not have the capacity?
I think the resources, yes, there is the will, and they expect to have 45 million doses. But there are capacity gaps in terms of resources that are available. So we can't for sure say that the private sector will not come in. And of course, we've seen previously, private players will come in terms of maybe where government, it takes longer for people to get the vaccine. Conveniency, yes, people will come in to pay pay the price for convenience's sake. If someone needs to travel and you have to wait on the list for government and they need to have that vaccine, they'll probably go for it. So the private sector surely will come in and play a role, and they will have to
But do you trust the private sector players if they get into the system? Doesn't this even make it more appalling? Because now I'll charge whatever I want because you don't know I got mine, or I will charge according to the demand that is with me, that when you come to me you get a job, it's at 20,000 Ugandan shillings, yet the government saying it's free. Don't you think this is going to open up more issues in the health system of the country?
But this has been the order of the day.
But how do we change that? I mean, I'm sick and tired of being on TV and we talk about... Lumbasi, how do we change this narrative then?
The government has to have that capacity and confidence from the citizens to know that what they have promised, they will deliver. The 45 million doses will be in here, and they will be timely, they will be efficient in terms of distribution of the vaccine, implementing that vaccination program. It will be efficient for the private sector to stay away. Otherwise, if the government the distribution, or there's gaps, there's no lack of efficiency, you cannot keep the private sector away, because this is a capitalist economy. Yes. People are on the move. They're not going to wait for an inefficient system for them to have their lives rolling. So
how do we bring in the private sector, like she says, for purposes of conveniency and being very dynamic, but keeping everything in check, that people are not extorted?
Yeah.
and we stay on the course of achieving as a country.
And that's key. The private sector most times comes in with a profit motive. So the last thing, and okay, I wouldn't say the last thing, but they will not ensure that Ugandans are able to provide and get the vaccine free of charge. Because for them it's profit, yes?
Yes.
So as a country, we need to ensure that the private sector is regulated. Ensure that as a government, we know which private sector is going to provide the jobs. We know at what cost these jobs are going to be. We should even be asking ourselves, should we let these jobs come at a cost? Are Ugandans even able to
We have a right to have.
Yes, are we able to afford the jobs that will be provided by the private sector? Most certainly not. I'm taking into the fact that most of our curious population and most of the target groups are not within the city. They are not within the suburbs, but are in far to reach areas. And they are even more vulnerable than these that can afford the jobs. So ensuring that these jobs are affordable to all to the whole population, and also ensuring that the private sector is effectively regulated during this process. I think that's one of the key things that the government can do to ensure that this vaccine is accessible to all Ugandans, and also emphasize that they are ensuring all our lives. Right?
Wow, that is a conversation. Thank you so much. It was great to have you, and it was great to have you, Elizabeth. Elizabeth Atori is a legal officer from ICE, and of course, Anne Lumbas is a program officer at SAHAD. It's a conversation we're having here, but time here cannot allow us, but online, be a part of this conversation. Let's find lasting solutions. Before you get a jab, what are your questions about the vaccination? I'll take a break for now. Morning at NTV. Continue shortly.